This is the Medical Minutes Podcast on the All Indiana Podcast Network. Your source for the latest news, updates, information, and more from the world of health and medicine. Now, here's Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. Omicron is out and Deltacron is in. Scientists describe this latest COVID variant as a marriage between Delta and Omicron. In this week's episode, I speak with Dr. Christopher Doehring, Vice President of Medical Affairs at Franciscan Health, about what we know so far about Deltacron, how fast it spreads, and if we can expect another COVID surge. Our conversation is next.
All right, so Dr. Doehring, always great to see you. Thank you so much for hopping on. All right, can you tell me the latest of what's going on in terms of this Deltacron variant? So what is it and what do we know so far about it?
Yeah, so what we've been seeing start to emerge, and we were actually seeing a little bit of it with the Omicron surge, is a subvariant that incorporates some aspects of both the Delta variant and the Omicron variant. And in certain other parts of the world, they're starting to see some surging. I wouldn't say that we're in a full-blown surge yet that's having the overwhelming effect that we've seen with prior surges, but certainly something that we're keeping an eye on and we'll need to be prepared for, as we have been all the prior surges we've dealt with.
Right. I know across the world, we've seen these surges in Hong Kong and China and parts of Europe. So when we talk about this, the characteristics of the variant, the combinations or the marrying between the two of the Omicron and the Delta. So characteristic of Delta is it's more pathogenic. Omicron is more easily transmissible. So are we saying it's sort of those two things come together, or are we not sure just yet?
Yeah, not 100% sure. Certainly, Delta was also more contagious, but more severe. Omicron took that contagiousness to an even higher level, the severity less so. And so it's a little unclear yet what we'll see with this so-called Deltacron subvariant. The good news is we've had so much exposure to both Delta and Omicron here in the United States for the past 6 months now, going on a year, that we, when you combine that with the vaccination rates, the booster rates, there is some reason to be optimistic that we will not be impacted in a significant of a way with a future Deltacron subvariant or any other variant that may emerge, at least in the short term.
Mm-hmm. Well, that do we know if the signs and symptoms are different from Omicron and Delta, or the stealth Omicron, Deltacron, whatever you prefer, whatever our preference is, I guess. Are the signs and symptoms different, or?
No, I think to this point, pretty similar. The thing about COVID all along is that there can be pretty much any combination of symptoms. The most common, of course, being more upper respiratory and respiratory, but you can also get GI symptoms. You can get other types of manifestations clinically. And so, right now, because there's very little COVID activity in our communities, most things that people are dealing with are not COVID. But if we were to start seeing an increase in spread, certainly we would entertain a COVID variant in the differential diagnosis for pretty much any combination of symptoms.
Well, I wanted to go back to the studies that showing protection against this Deltacron. So I read something that protection drops to just 10% as early as 4 months after the third dose of the mRNA vaccine. So what does this mean? Should Deltacron move forward? I mean, any sort of protection is great, of course, but what do we make of this?
Yeah, so I think that's going to be part of what goes into the decision making around additional boosters. We've certainly arrived at a point where we're hopeful that future variants may emerge on a seasonal basis, not unlike the flu, but I think it's still too early to tell. Certainly Delta last year emerged during the summertime, and that's not exactly seasonal flu-like behavior. So, we'll see if additional variants emerge off cycle. But if we do get to a point where this becomes more seasonal, then we should be able to marry it up well with an annual booster type situation or targeted annual vaccine for whatever seems to be circulating.
Yeah, it's looking really promising. It's going to be that way. And this thing doesn't play by the rules. So
I know, really that's right.
Yeah.
And even though it's been 2 years now, the rules are still being written. So we don't know exactly what the rules of engagement are going to be on a long-term basis, but certainly we're hopeful.
Yeah. Well, I'm certain that, in addition to the questions I'm asking, it's just sort of perspective. We can't predict the future. We don't know what's going to happen. But I think we have sort of speaking to another doctor, and he's saying, I think the best thing that we have is we're starting to establish a pattern. So that's something that can give us a sense of ease, relief, or sense of security, let's say,
Sure.
at least for now, even though we haven't sort of nailed things just yet. So I wanted to talk about, speaking of vaccines and this sort of drop in terms of well, first, I'm curious why maybe it was just tested in the mRNA vaccine as antibodies dropped to 10% as early as 4 months. But any reason why it would be the mRNA, or was that the only one that was tested?
Yeah, and I'm not 100% sure exactly what all has been looked at there. Certainly, there's differences between natural immunity, vaccine-mediated immunity, which type of vaccine. Did you cross vaccinate with the different mRNAs or even the J&J. So a lot of different factors play into that. And then, what antibodies are actually circulating versus what antibodies get revved up when you get exposed can be, two different things as well. So you may have much lower levels of circulating antibodies, but you still have the protection that's raring to go if and when you get exposed. So a lot of different ways to look at that.
So we may see hospitalizations going up, but we're not seeing any deaths are
I think it's at this point, the background spread of the virus is so low, it's less than 1% of people that we are testing that don't have any symptoms, that there's really little risk in the short term that we're going to, start seeing a significant uptick. As we watch and monitor the spread of these variants in other parts of the world, we will be able to sort of monitor that if and when it comes to the United States and what areas of the country are particularly vulnerable. That is going to be impacted by the background immunity that exists from having had Omicron, having had Delta, having been vaccinated, which right now seems to be holding up pretty well for us here in central Indiana.
Okay, good. Well, any last thoughts on this Deltacron? What is your message to Hoosiers?
Well, I think the expectation is we will continue to see variants emerge. Whether or not we see any that will break through the sort of what I would call pseudo herd immunity that's been established, and whether that immunity protects against severe illness, hospitalization, and death will be something that we'll monitor over time. But for now, let's enjoy the relatively calm seas that we seem to be benefiting from.
Oh, that's such a great way to put it. Dr. Doehring, thank you so much. Moving on to the next topic. Moderna announced the company will be seeking emergency authorization for the fourth shot, second booster, for its COVID vaccine series in all adults. This comes sort of at the heels of Pfizer executives saying it's requesting approval for second booster, fourth shot of its series, but only for people over 65. I'm wondering what your thoughts are in terms of these strategies.
Yeah, so apparently Pfizer actually looked at this in the experience that they had in Israel, and because they've been offering that fourth dose to those high-risk populations. And so that's really what their request was based on, an actual trial that was performed in Israel. So and then the Moderna booster is really based on what they've been observing in some of the real world experience. As you just mentioned, some of the declining antibodies, they're seeing, there is a need for continued recurrent boosters in order to maintain that protection, which is why they've asked for that booster approval for all ages. So the Pfizer recommendation, or sort of, way in which moving forward, their data was based on Israel. Is that what I'm hearing? And then Moderna maybe looked at sort of a broader sense in terms of a broader population and said, no, actually, we really
are going to need this for all adults.
The Pfizer was based on actual studies that was performed to intentionally answer the question amongst those who were over the age of 60. The Moderna was based on the observation of what was actually happening in both the United States and Israel, but not necessarily in the context of a research arm or a specific trial to answer that question.
Okay, so the data from Pfizer was sort of a experiment, but then Moderna is sort of
more targeted.
Exactly. And I mean, I guess we've
And I think part of their rationale for doing it that way was, these are the most high risk populations. We know this is where the highest rates of hospitalization, severe illness, and death come from, and so that's why they specifically did their trial to look at those higher risk populations. Whereas, again, with Moderna, it was more looking broadly at the benefit of that additional vaccine dose and what happens with the waning immunity, over time, as far as protecting against some of those severe outcomes.
Well, the way which Pfizer had done the experiment, it makes sense, kind of, considering that's the way we've been doing things, pretty much all along. But it doesn't really make sense to me why Moderna would come out with this 18 and over. What are your thoughts on that?
Well, again, and whether I don't know specifically if they have ongoing trials. My suspicion is they probably do, but they saw enough in some of the real world evidence that they were able to glean to go ahead and make that request of the FDA and to have that fourth dose, that second booster approved and ready to go. At this point, we're still encouraging folks to get their first booster, their third dose. And so we still have a little ways to go to get that uptake done. But having this additional booster approved will then, I think, help us be prepared if and when another variant emerges and if we start to experience another surge, in the coming months.
Okay, so we're prepared. Such insightful stuff. Thank you.
There's always questions to be answered, and we're continuing to learn throughout this whole process.
Totally, absolutely. Last question for you. So I've been speaking to some doctors about vaccine dependency, and one doctor had phrased it is that these shots for now seem like a temporary therapeutic. Vaccine dependency, well, it seems sort of self-explanatory. Is there in your sort of perspective, are we clear to that place with the COVID vaccine?
Yeah, that's sort of the public health debate, right? How severe is a communicable disease? How important is it to try to protect the population broadly against it with vaccination versus how much do you just let it run its natural course? In this case, I think it's well documented throughout this pandemic that while younger populations are not as vulnerable, they are certainly vectors of spread to more vulnerable populations. And so it's sort of a two-pronged approach. You want to minimize the spread as much as you possibly can, and you want to protect the most vulnerable from that severe illness and those worse outcomes. It's not unlike the journey we've been on with influenza. It wasn't that long ago that influenza was really targeted for those 65 and older. We didn't really worry so much about younger people. Well, now we've come, over the last decade or so, we've come to the point where influenza vaccination is recommended for virtually everyone, 2 years and above. And so we understand that, yes, protecting the most vulnerable is a key part, but also doing what we can to limit the spread is a big part of the public health initiative as well.
Yeah. Oh, wow. I didn't realize that about the flu shot. I guess it goes sort of the same sort of research sort of process as we've been looking at. Makes sense. And then I have a question for you. So I forgot my question. I thought it was a good one. Vaccine
I'm sure it was. I'm sure it was probably the best question.
The one question, out of this all. Okay, vaccine therapeutic. Maybe we just haven't found the right dose yet. I don't know. That's what I'm thinking. And then, you know what? A kid's got it. I was thinking, you know what? I just going back to what you were saying about like, right, how much is too much? We got to get it let this run its course at some point. It's like don't let the kid break the food, you know? So that's just what I was thinking in terms of this kind of stuff and right. the reasoning behind my question, just to get your perspective.
Yeah, no, I mean, I think back to the issue of vaccine dependency, there certainly are some illnesses, some diseases that ideally we would eliminate the natural spread from the planet with widespread vaccination. Certainly polio is an example where we've largely accomplished that. And unfortunately, we've never completely eliminated it, but pretty much have eliminated it from the planet. It's unlikely we'll get to that point with COVID, just by the nature of the respiratory virus and how it changes over time. But certainly getting to the point where we can turn it into more of a nuisance than a life-threatening, worldwide spreading virus is certainly the outcome we're seeking. And that's where having widespread vaccination, so-called vaccine dependence, really helps us.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
This is the Medical Minutes Podcast with Wish TV's Dr. Mary Gillis. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast. And discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.